People and physicians are now turning to probiotics to optimize their gut microbiome. But does it really help? Should everybody be taking a probiotic? And how do you decide which one to take? Fecal microbiota transplantation is a not-so-new treatment that has recently resurfaced, and the research is getting really interesting. First off, though, what the heck is fecal transplant? What is FMT? Now, it's pretty much what it sounds like, but this is when you take the feces, the stool, from a healthy donor, and you blend it up, create a slurry mixture, and this mixture is infused directly into the colon of somebody who has a condition that might benefit from changing their microbiome. So you might be saying, why don't we just use probiotics, right? We're going to talk about this in the probiotics video, but probiotics don't actually recolonize your gut. You should think of a probiotic as a tourist. They simply act as travelers that pass through the intestinal tract and can have a beneficial effect while they're there. FMT, on the other hand, this is one of the ways that we can actually shift your microbiome. FMT might sound like a new therapy, but it's actually been around for a really long time. The first FMT dates back to the 4th century China. They called the treatment yellow soup, and they used the treatments for cases of severe food poisoning as well as diarrhea. Yellow soup, and yes, that is a poop reference. But the nomadic groups have also been studied to have stories about the fact that they ate the camel stool as an ancient remedy for bacterial dysentery. And no, this is not a treatment that I recommend. FMT has also been used in veterinary medicine for a really long time, and it was used to heal sick animals. Vets would infuse a healthy animal's poop into a sick animal. And if you haven't noticed, many animal species practice something called coprophagia. This is a Greek word for eating poop. The evolutionary idea behind coprophagia is that it helps create a robust and diverse gut microbiome. Maybe our pets are actually onto something. But again, definitely not advised. Currently, FMT is only approved by the FDA for a Clostridium difficile infection, also known as C. diff. C. diff is a life-threatening infection that can cause inflammation and ulceration of the intestines. This infection is typically acquired in hospitals after antibiotic treatments have totally disrupted the gut microbiome and created an imbalance that allows for the pathogenic bacteria to overgrow and cause colitis, diarrhea, which can actually be deadly in some instances, especially in older adults. The conventional treatment for C. diff is another antibiotic course. And yes, C. diff is typically caused by antibiotics, but we're also treating the infection with more antibiotics. And to be fair, the use of antibiotics is actually very effective with C. diff. For the first infection, 70 to 90% of people experience a resolution of their infection after the use of antibiotics. But the real problem arises is that it's not the end of the story after the first infection. So when you use an antibiotic to treat C. diff, there's a 25% relapse rate. This is very high. When you use fecal transplants to treat C. diff, on the other hand, there's a 90% cure rate, but only a 5.5% reoccurrence rate. This makes a ton of sense though, right? Because you're actually treating the root cause, which is the fact that we wiped out the beneficial bacteria in the beginning with the initial course of antibiotics. And now we're reinstalling the microbial community. So we're actually reseeding the intestines. Antibiotics can wipe out your gut flora, the good and the bad. And when we do this, opportunistic bacteria can overgrow and lead to infections just like C. diff. FMT, again, it's like reseeding the forest that was wiped out, and it makes a lot more sense. The other downside with antibiotic overuse is the potential for the creation of resistant superbugs. Now, despite these statistics, antibiotics remain the standard of care treatment for C. diff. It's only after antibiotics fail several times that most doctors are turning to FMT. This is not to say that there's no risk factors with FMT though, and as most other therapeutics, there are risks. FMT has even led to deaths. There have been a couple cases where FMT was given to immunocompromised individuals. These is people who have immune systems that were unable to fight infections, and they acquired a rare E. coli infection that was present in the donor's stool. The donor's stool should always be tested for these pathogenic infections. However, there's always the chance, like in this case, that the bacteria is rare enough that it wasn't part of the normal screening procedure. In this instance, 21 other people received this donor's stool. However, only one person died from it, likely due to the fact that that same person was immunocompromised, making him not able to fight the infection in the first place. That being said, testing the donor stool is super important, and there's a lot of people who feel desperate to get a fecal transplant, and they're doing them at home with untested donor stool, potentially putting themselves at risk. So you might be saying, if they can only be used for C. diff, then why the heck are we still talking about them in this gut health course? Well, FMT has some research behind it for other conditions that are not FDA approved currently in the United States. One of the most promising conditions for FMT treatment is ulcerative colitis. A recent clinical trial that was published in 2019 showed that in patients that have moderate ulcerative colitis, 32% experience clinical remission and endoscopic remission. What this means is that their colonoscopy looked normal and they had reduced symptoms. And this was done after a series of FMT infusions. While only 9% of the participants who received the placebo infusion went into remission. But a quick aside, yes, 9% of the study participants went into remission with FMT that was a placebo. This is the power of the placebo. Now, the study was also pretty small. It was only 73 people. However, 42% of the patients who achieved remission maintained it for 12 months. This 1 week treatment of FMT affected people for 12 months after. It's pretty remarkable given that FMT is relatively safe in people who have a normal immune system function and whose donors are well screened. The other common treatment for IBD are biological drugs, which suppress the immune system, meaning that they reduce your body's ability to fight infections. They also may increase your risk for getting sick. Biological medications can also increase the risk of certain cancers. Now, I'm not anti-biologics because I've seen them turn people's lives around and greatly improve quality of life. I think that they have a role in medicine, but I also think that we need to address the root cause of why the immune system has gone awry instead of just shutting it off completely. FMT is restoring the terrain that should be there, but for some reason has been disturbed. It's like reseeding that forest. In functional medicine, we always talk about addressing the root cause, and FMT may be one of the best ways to do this. Before we wrap up for today, though, I want to discuss a non-gut related condition that FMT might be able to benefit. Alterations in the intestinal microbiota are associated with obesity as well as insulin resistance. Insulin resistance is when your body starts to be overwhelmed by the amount of sugar that we're exposed to on a daily basis. So what it does is that it increases the amount of insulin that's produced to help deal with the increased sugar levels. Insulin's job is to put the sugar into the cell. So more sugar that's hanging around, the more insulin we need to handle it. But after a while of putting out more and more insulin, your body gets tired and your cells stop responding to the insulin. So the sugar ends up hanging out in the bloodstream and you have an increase in blood sugar levels. And since the sugars can't get into your cells, then your cells are still starving for energy. And so your body still feels hungry. Your tissues aren't getting the nourishment they need, and they're exposed to high blood sugar levels, which can damage the body as well. This is what we call insulin resistance, and it's the beginning stages of diabetes. There have been a few animal studies that show that when you do a fecal transplant, taking the stool from a lean mouse and put it into an obese mouse, the obese mouse becomes lean. And the opposite has also been found. So if you give the stool from an obese mouse and put it into a lean mouse, then the lean mouse gains weight. This has been done in humans as well, but we haven't found the same results consistently. What researchers have found is that when they use a donor that has a healthy metabolism and they gave it to individuals with insulin resistance, the recipient's insulin sensitivity improved significantly 6 weeks after a fecal transplant. What is interesting though is that the subjects didn't lose weight. But this is still really significant in the treatment of diabetes. Improving insulin sensitivity is still beneficial for your health, totally separate from weight loss. We know that the donor that's used in FMT is a really important variable. Studies looking at its efficacy in IBD show that the results are donor dependent. So when 2 donors were used in one study, they found that people improved from donor A's stool, but they did not improve from donor B's stool. We don't quite know what makes the best donor though. So before we come to any conclusions about FMT not being helpful for weight loss, we also need to further investigate what makes someone a super donor. What's the optimal superhuman microbiome? When we find this out, we might be able to help a lot more people. I could geek out on FMT all day long, but I want to get to the next video because there's a good chance that each and every one of you have tried these supplements at one point in your life. Most people have taken probiotics without knowing why they are really taking it or what they are. You now know that probiotics do not recolonize the gut bacteria. So should we even be taking them? Should everyone be taking one for general health? And what about kombucha? What about the fermented things? And what do they actually do for us? The research is pretty clear. The gut-brain connection and the importance of the microbiome are undeniable for overall health as well as longevity. People and physicians are now turning to probiotics to optimize their gut microbiome. But does it really help? Should everybody be taking a probiotic? And how do you decide which one to take? And should you be consuming fermented foods? We're gonna hit on all of these points in this video, and we're gonna start by breaking down a couple of big myths. One of the biggest myths in gut health is one that I've already said a few times throughout this course, but it's really important to know. Probiotics don't recolonize your gut microbiome. That's right. If you're taking Lactobacillus acidophilus in the form of a probiotic in the hopes to increase the amounts of lactobacillus in your gut, then it's not going to happen. They simply act as travelers that pass through the intestinal tract and can have beneficial effects while they're on their way through. They offer benefits while they're passing through, like supporting the immune system, and they can even communicate with other species there, possibly crowding out bad bacteria and preventing bacteria from overgrowing. Most of the probiotics on the shelf are transient, meaning that they're bacteria that actually don't recolonize the gut ever. For instance, Lactobacillus acidophilus is one of the most common probiotics, but the same species is not a common inhabitant of the human GI tract. One study suggests that 25% of humans have no detectable levels of Lactobacillus acidophilus present. This doesn't mean that they're not useful though. Transient species come from probiotic supplements and fermented foods like kimchi, and they can have a lot of benefits to humans. Probiotics can talk to our human cells and cause the release of neurotransmitters or anti-inflammatory messengers to help balance the immune system in the gut and the body as a whole. But remember, they do not recolonize the gut. Now, let's dive into some specific probiotics and what the research is saying. When mice were given a probiotic, Lactobacillus rhamnosus, the expression of GABA receptors in the brain were altered. GABA is the inhibitory neurotransmitter that helps to calm the brain and reduce anxiety. These mice showed signs of decreased depression as well as anxiety, all from a probiotic. Lactobacillus helveticus and Bifidobacteria longum have been shown to reduce anxiety, depression, and anger, as well as decrease hostility in healthy individuals. And remember that we said our microbiome affects our ability to make cortisol and deal with stressors. These same 2 probiotics, the Lactobacillus helveticus as well as the Bifidobacterium longum, have also been shown to lower cortisol levels. A probiotic combination containing Bifidobacteria lactis, Streptococcus thermophilus, Lactobacillus bulgaricus, and Lactobacillus lactis all altered the emotional response to pain as well. This is important when we think about it when it comes to conditions like fibromyalgia and IBS. A huge percentage of people with fibromyalgia have gut symptoms like bloating, constipation, diarrhea, and most also have a positive SIBO breath test. In both IBS and fibromyalgia, there's an abnormal level of pain despite a lack of pain stimulus. This means that they perceive an exaggerated level of pain despite there not really being a stimulus for that pain. And using probiotics or diving further in and figuring out how we can actually shift the microbiome to create a similar level of pain reduction is a really interesting field of study. The study shows that bacteria in our intestines actually modulate the central nervous system, and they can modulate how we perceive pain in our pain pathways. In clinical practice, I use a couple of probiotics regularly for certain conditions, so let's talk about those. Saccharomyces boulardii, or S. boulardii, is one of my favorites. S. boulardii is actually a yeast in itself, but what's interesting is that it acts as a competition, like a crowding out of other bad yeasts that can be helpful in the treatment of SIBO as well as SIFO. In SIBO, you want to be really cautious about using more bacteria because in its essence, SIBO is an overgrowth of bacteria already. I don't prescribe probiotics to these individuals that have SIBO right off the bat usually. I talk about the treatment for SIBO in the SIBO video, but after we have reduced some of the bacteria levels with some of the other treatments first, then I go to a probiotic like S. boulardii. So this helps to crowd out some of the potentially bad bacteria as well as yeast. Now, I also want to talk about a spore-based probiotic. Spores enter the GI tract and they hibernate, and they can withstand the low pH of the stomach, which makes them really attractive because sometimes the pH of the stomach can actually degrade probiotics that are there. So when they hit the higher pH in the intestines, the spores will open up and they can do their work there, making them really successful at their job. Spore-based probiotics like Megaspore Biotic are useful because they are shelf stable, so they don't require refrigeration either. Some of the bacillus spores that are found in this product have been studied for their effect on reducing pain from rheumatoid arthritis, improving leaky gut by repairing the connections between cells as well. So these spores act to recondition and repair the gut. Think of them as your gut maintenance group. One big myth about probiotics is that they need to be alive to benefit the host. Fortunately, your probiotic is still going to be effective even if it's dead. People sometimes over-obsess about keeping your probiotics refrigerated when they're on vacation or you're traveling, and my advice is always this. Now, the research shows that even a dead probiotic can still exert its effects on the host. Obviously, if you can keep it refrigerated, then great. But dead probiotics still talk to your other microbes and can still communicate and modulate your immune system. The mere structure and presence of the microbes in the probiotic can interact with our living microbes and our human cells to interact and lead to changes in our immune system and inflammatory response. Now, does this mean you should stop refrigerating your probiotic because it's, not shelf stable? No. There's going to be benefits likely to having a living probiotic, but what it does mean is that you don't have to go and throw away your probiotic if you had to keep it out for a longer period of time. So when you're looking for a probiotic, you want to take a few things into consideration. First thing is, what strain does it have? Now, your doctor should be able to tell you or help you find a strain that's going to benefit you for your specific health goals. The second thing is, how many CFUs does it contain? And this is a measure of the amount of microbes that are present in the probiotic. The minimum dose you should be looking for is 2.5 billion CFUs. And in some sensitive individuals, you will start with much lower amounts and then increase as you can tolerate it. For instance, in ulcerative colitis, you can sometimes increase people's probiotic dosage to 50 billion or even a trillion CFUs. But this gets really expensive really fast, and you want to go slowly, and you don't want to just jump to a trillion right off the bat. The third thing to consider is that when you're choosing a probiotic, you want to figure out if it has a prebiotic in it. So there's ingredients like FOS, which is fructooligosaccharides, and this is a fiber that feeds our microbes and is frequently added to probiotics. In some people, FOS can actually be a cause for symptoms. It can make things worse, especially in conditions like SIBO, where gas and bloating are really big issues. When you take the probiotic also matters. So when should you take a probiotic? Remember that the pH of the stomach is really acidic and can damage these probiotics. So when you eat, the acidity in the stomach actually drops because extra food in the stomach helps to buffer the acidity level. This is why I have people take probiotics on a full stomach with meals. So we covered probiotics, but let's dive into another category of prebiotics and postbiotics quickly. Prebiotics are foods that feed your microbes. Probiotics are the microbes themselves. And postbiotics, again, are what the microbes produce, like short-chain fatty acids, which we discussed earlier. Prebiotics are anything that contains soluble and insoluble fibers, which are the main fuels for our microbes. Humans cannot digest fiber, but the inhabitants of our guts, our microbes, rely on fiber as their primary fuel source. There are also prebiotic supplements that contain things like inulin or chicory root. These are actually really beneficial to some people, and they can also aggravate other people. So people with SIBO are not going to do well with, say, inulin that's in a protein bar. If you take prebiotics and you get bloated or you have diarrhea or constipation that worsens, then you should also wonder if you have SIBO as your main issue. Prebiotics can be really beneficial to people who are trying to maintain or lose weight and don't have SIBO. Prebiotics do this by slowing down how quickly the stomach empties to increase satiety, meaning that you feel full longer. They also decrease the absorption of cholesterol from our diet, which can help with metabolic syndrome, as well as obesity and people with cardiovascular disease. Prebiotics also help to increase the amount of short-chain fatty acids that are produced and can help repair the intestinal lining from leaky gut. But the big takeaway is that there is a time and place for prebiotics, and they can make some GI conditions actually worse. So you want to talk to your doctor to see if it's an appropriate time to introduce them now or if you should wait till later. The same supplement may make you worse at one stage of healing, but can be really beneficial at a different stage. The big takeaways I want you to leave with today are that probiotics can be really helpful in certain conditions, but grabbing one off the shelf, having no idea what strain is in it, will probably be a waste of your money. I actually don't recommend probiotics as one of the supplements that everyone should take every day for prevention. Instead, I think we should be eating foods that are high in fiber to support the growth of our own microbiome. And buying more veggies straight from the farmers will actually have a more beneficial role than probiotics themselves because of the little pieces of dirt that they contain. And prebiotics are the food sources for your bacteria, and they can be used therapeutically to help certain conditions, and they can also make certain GI conditions worse, so talk to your doctor first. Tomorrow we're going to talk about your endocrine system and how that affects your gut function. This is your hormonal system, including your sex hormones, thyroid hormone, and cortisol. Remember, your body is an orchestra. Each system is an instrument, and all the instruments need to be in place to make things work smoothly.
Hey, thanks a lot for watching. If you enjoyed this video, then I think you'll love this one too.